One, let's have the continuation of last class. That is, we were discussing electric shock. So now we are going to discuss what are the two types of electric shock. That is macro shock. One is macro shock, another one is micro shock. So from the name itself, you can come to know what is the meaning of this macro shock and micro shock. So first we will see what is the macro shock. The macro in the sense it's a large, and shock you know already, that is the current flow in through the body, the sudden current flow which is passes through the body, which leads to some adverse effects. So this large amount of current, when it passes to the body from one point to another, that is through the skin or other the tissue, it will disturb some sort of mechanism. So that type of shock is called macro shock. So current path for this particular shock is like typically it flows from one external point to another. That is, either it can flow from hand to hand, that is upper limb to this limb, through the heart it will pass, or from hand to foot, that is from upper limb to lower limb, through the heart it will travel. So this is the current path through which the macro shock will throw out. But thing is that it will passes through the body externally through the skin and the tissue. That is the main difference between macro shock and micro shock. Next one is the threshold of the danger. So the all the current, okay, all the current will not produce a shock or will not give any kind of harmful or adverse effects. It depends upon what are the current intensity or current duration. Okay, so if you are passing 1 milliampere of current, in the sense that is the maximum threshold point where the people will not feel any kind of sensation. So just they will like have like tingling or some sort of sensation. If you are passing 5 milliamperes, there is a maximum harmless current from to which up to which the person will not feel any kind of sort of problems. That is the maximum acceptable range for the people to have the current of 5 milliampere. Next one is 10 to 20 milliampere. This if this quantity type of current range, if it goes into our body, it will leads to some sort of pain, or have uncontrolled muscular contractions. That muscular contraction may be like it will disturb your respiratory muscles or other main muscles. So it will leads to like what yeah, respiratory paralysis may be occur to the patient, or a cardiac fibrillation may also lead. So these are the things will happen into 10 to 20 milliamperes. If you are giving current beyond that, that is 50 to 100 milliampere, means totally it will affect the heart. That is, it will produce ventricular fibrillation. It means that your ventricles of the heart will beat out continuously in irregular manner. So if it is affected in such a way, the ventricular will not good enough to give or to produce quantify amount of blood to be circulated to all over the body. So ultimately the blood cardiac output will get reduced. The organ will not get enough blood, and the organ failures will produce, and at the end the people will get die. So these are the things will happen subsequently when you are pausing 10, 50 to 100 milliamperes. So the main source of these sort of problems of current leakage to the body is especially from the electrical equipment. If there is any fault in the electrical equipment, there is the chance for the current to get flow into the patient. And second one, as we discussed, where if you are using any exposed wires, or if you are using any medical device without proper grounding, you may also have a current leakage or current passage to the patient. So these are the things we have to be very careful when you are using the medical device very carefully in order to prevent this macro shock. So next we will be seeing what is micro shock. So micro shock, the word the micro represents this lot a small amount of current. Okay, here we are going to have a very small amount of current flow in the body, but it directly affecting or directly passing into the heart. So the case, in which case this type of micro shock will occur, in the sense whenever we are using any non-invasive materials, like if you are using any catheters or invasive type of electrodes or needle electrodes, if you are using in these kind of accessories, there is a high chance for the person to get a microshock, because these accessories like catheters or electrodes, invasive electrodes, will make direct contact to the targeted place. That could be heart or some other things. It since it making direct contact to the organ, so there is a very high chance for the shock to get directly affect the organ. So even the very minute leakage current is good enough to produce the shock. So that is the thing here. The main difference between macroshock and microshock is the current path is only difference is the current path. The macroshock, the current path, the current is flow from one point to another point through the skin or tissue, that is externally it flow. But in microshock, the current flow directly to the heart through the invasive catheter or the electrodes. So this is the one difference which exists between microshock and the macroshock. So example for such macroshock is angiography. So if the person is undergoing any angiography procedure, obviously we will be using what, a catheter to navigate for navigation purpose. Or if you are using any other surgery also for procedure they will be using what, catheter. So these catheter is a connection of so many lead wires, and it have the option of like cutting, coagulations, and camera sensors, and so many electronic parts are there in one hand. So if there is any faulty over there, or if there is any short circuit or any kind of issues, if it is there in the catheter in the sense, or automatically it will affect the particular targeted area, that could be heart or any other area where you are focusing. So that is the main reason for the person to get microshock when you are using catheters or the electrodes. Okay, so this threshold of danger for this sort of microshock is 10 to 100 mu A. So the 10 to 100 microampere is very much high for this particular shock to occur, whereas in case of macro shock, the range is like milliamperes. But here micro shock, the range is like very minimal, that is a microamperes. But then this particular microamperes is very high enough to produce the shock. So compared to macro shock, the micro shock is very dangerous, because here we are making a direct contact with the organs. So that is the thing, we have to be very careful about the device what we are using. Okay, so here I have brought out the comparison of current path for macroshock and microshock, and then a certain features comparison between macroshock and microshock. So path of current, as I said before, for macroshock it is externally body surface. For microshock it is being affected directly. And then dangerous of current, that is a threshold to the danger is macroshock, that is greater than 50 milliamperes, and microshock is as low as 10 to 100 microamperes. The risk to healthy people is it is high. For macroshock it is high, and for it is low unless internal access to the heart. The reason is like no people will go directly with invasive method. Okay, so the chances for getting a shock, macro shock, is high compared to the micro shock. If the person is going non-invasive procedure, then the micro shock is have high risk compared to the macro shock. So these are things like whether the person is going a non-invasive method or invasive method, or using internal device or external device. And for the type of people or the patient is being affected is for macro shock is moderate, especially the ICU people. Micro shock, the ICU people is being affected too high, because all sort of ICU people will have internal procedures, like they will be having internal devices, so the risk will be high when compared to the macro shock. So this is the overall comparison between what is macro shock and micro shock. In less class we will discuss what is prevention method or management techniques we can be followed in order to prevent this sort of micro shock. Thank you.